Muthia mutongoria wa bururi Uhuru Kenyatta nianireire gucoka thi kwa murimu wa Covid-19 guku bururi-ini akiugona thengia wa Akenya kuhinyiririka ni mawatho maria thirikari ikirite maria muimite muingi kanyaga gutabania maundu ngurani. Mawatho macio riu ni monanitie maciaro.
We are in the middle of a crisis, as you all know, and we must analyze as it unfolds and changes form. The good news, though, is that in the middle of this crisis, the curve is beginning to flatten.
Onna gukiria uguo hatire bata wa gukungwira undu uyu na kuriganirwo kwimenyerera. Mugathe Uhuru akiuga no twikore haceke kuona ihinda-ini riri murimu no wonekanyaga gutherema ona makiria.
We must not celebrate this happy moment too soon, but rather celebrate it with a great deal of caution. More so because the curve begins to flatten after it reaches its highest point. This point is also called the inflection point. And it is the most dangerous point because the curve can either flatten and de-escalate or take an upward surge.
Murimu wa Covid-19 wokire na githomo kiria giteithiriirie thirikari gutangikira ruhonge rugima rwa mwiri guku bururi-ini na njira nene gukira hau kabere, kuona mirimu iria yumanaga na mai ma giko nicokete thi guku bururi-ini. President akiuga maundu maria thirikari ihimbiire ihinda-ini riri matikaregerio.
Some of these positive measures that we have adopted during this pandemic should become the new normal, should become the new Kenya, should become the way we move forward. And we should incorporate and build upon these as we continue, as indeed was said, to strengthen our capacities, especially in our community workers, in our health workers at the grassroots levels, to be able to help us ensure that we are able to prevent before we need to get to the cure.
Origenia hete ministry ya ugima wa mwiri ihinda ria thiku 30 kuonania mibango iria gathikitwo kuonania kuri na waragania hari mitaratara ya uguri wa indo niguo kurigiriria kura kwa mbeca cia muingi toria gukoretwo gugicukirwo ruhonge-ini rwa KEMSA. Na oho akiuria ministry guthondeka mubango wa guteithiriria muingi hari kuhurana na thina wa kimeciria uria umanite na mathina maria Covid-19 nishugiriirie muingi.
I really want to say that it is not just the relatives or the health workers, but it is the population at large. I mean, there has been a huge impact as a result of the lockdown that we have had on our young people who have felt restrained and constrained from the liberties that they know.
Maya magithiaga na mbere umuthi andu 148 nio monekanite na murimu wa Covid-19 thutha wa andu 260 guthimwo rungu rwa mathaa 24 guku andu 3 magikua nao 205 makihona rungu rwa mathaa 24.
Asanteni sana na Mungu awabariki nyote. Asanteni. Kwaheri ya kuonana.
Hadoini ha Kameme TV geto waithira wa Kihara.